As health centers are making layoffs in order to reduce their bottom lines, smaller hospitals worry about making sure departments don't suffer. ABC 22's Kieran Nigro reports tonight from St. Johnsbury.
Vermont does have a problem. We have an aging demographic, a lot of older people who need a lot more care, and Vermont simply doesn't have the resources to cover all those costs.
The CEO of Northeastern Vermont Regional Hospital tells me the Green Mountain Care Board advised the hospital they need to cut costs by $2.5 million this year. Effective September 30th, NVRH will close its Occupational Medicine Office, transferring certain services to Northern Express Care.
This will be a work in process, and we're engaging our teams in order to figure out how best to deliver those services. However, things like DOT exams or drug tests are certainly on the table.
Tester says he'll also offer an early retirement program as another way NVRH is trying to keep a tight budget.
I think we have at least a dozen people who are taking that as an option.
A total of 5 positions will be impacted by all of the organizational shifts, including members of the occupational medicine team, a community health resource center coordinator, and a physical therapy assistant at Northern Physical Therapy.
These are all great people. This isn't their fault. This is really due to the tremendous pressures we have on our system. It's incumbent on us to try to find savings.
All 5 positions affected will have the opportunity to apply for other jobs. They were also offered severance packages along with assistance for any transition they may make. NVRH is also expanding its emergency department. Built in 1972, it was designed to treat 25 to 30 patients a day. That was then. Now, the ED is seeing anywhere between 40 to 60 patients a day. Nursing Director Sarah Chrisman says renovations will give her department the ability to increase efficiency.
We will actually have actual treatment spaces rather than some of the nooks and crannies or the hallways and other office spaces that we've tried to commandeer to patient treatment spaces. We will have truly dedicated treatment spaces to see patients.
She also tells me about some of the upgrades she's looking forward to.
Rooms will be up to code so that we will have sinks, the things you take for granted. We've got hand washing outside the room, but nothing inside the room. Rooms will also be bigger and longer, so we can actually effectively move people from EMS stretchers onto the hospital stretcher as well without being so scrunched in there.
The emergency department expansion project is being completed in 2 phases and won't be fully complete until 2027. Kieran Nigro, ABC 22 News.